I am Sophie's mom. My name is Brandy. Sophie was not speaking at a year old. She said mama, dad, dad, but then she completely lost her language skills by 15 months. And whenever she got to 18 months, the doctor kind of said, hey, it's a red flag, you've got to start something.
Hi, my name is Ann Ahern. I'm an occupational therapist at St. Luke's North Pediatric Rehab. I had the pleasure of evaluating Sophie when she was 2 years old. She was referred for occupational therapy due to a speech delay, actually. She was seen by our audiologist and for a hearing test to make sure that there was no medical reason why she was not speaking. When she was evaluated by audiology, they realized that she didn't have a hearing deficit, but in fact had trouble with letting people touch her ears and her face. So she was referred to occupational therapy for a sensory processing evaluation.
She was extremely sensitive to sound. She could hear an airplane going over the head before you would even see it, and it would upset her. She'd cover her ears like it was way too loud. She didn't like to be touched. Washing her hair was a huge issue. It was basic daily things like washing her hair, brushing her teeth that were becoming a big, big problem for us.
Sensory processing is the way that your body interprets everyday stimuli that you encounter in your environment. So it can be how you interpret movement, how you interpret sounds, how you interpret tastes, touch. Some children and even adults have difficulty with how they are interpreting the input that they are receiving, and that affects their ability to do everyday activities.
For occupational therapy, I just wanted to be able to carry out a daily routine, basic hygiene, taking her out in public when we were potty training, being able to wash her hands in a public restroom without her having to go into a complete meltdown.
For Sophie, her deficits, she was hypersensitive to not only movement, which is your vestibular system, but also your tactile system, which is how you perceive touch, and auditory, how she perceived sound. So for Sophie, the treatment consisted of doing whole body activities, where there were activities that I did with her, where she would do activities like the crash pit behind me, where she was getting input through her whole body so that she could help feel where she was in space. I also used what we call suspended equipment, which are different kinds of swings. I would do very specific type of movement with her in those swings to help her, again, feel where she was in space. Once she was able to handle that movement, I could work on the tactile system, or how she perceived touch.
My name is Kelly. I'm a speech therapist at St. Luke's North Pediatric Rehab. So Sophie was a special case. She was actually a patient where we got to work with multiple disciplines at one time. She was initially referred from audiology to occupational therapy. And then the occupational therapist referred her to speech after about 6 months of working with her. We participated in co-treatments for all of our speech treatment sessions, where we were treating with occupational therapy and speech together. So occupational therapy worked a lot on that sensory organization so that Sophie could participate a little bit better in the different speech activities I was giving her, and that her speech intelligibility would improve gradually over time.
I think the care that she received here at St. Luke's stood out because they were extremely personable. They kind of directed us in where to go, because whenever you have a kid and you find out there's something wrong, you're not really sure where to turn next. There's not a guideline out there that says this is what you need to do. So they were very great in guiding us and saying, you need to go do this next, you need to go do this next. Here are things you can try at home. They got to know our family and her quirks and what made her thrive, and they kind of specialized her treatment to our family. It wasn't just like an across the board kind of thing.
When Sophie first started in speech therapy, she had very few words, if any. She was using about less than 10 consistently, and she had about 30 signs that she was using. So by the end of speech therapy, Sophie was speaking in full sentences, 9-10 words in length, telling stories, using age-appropriate structures and grammatical structures. She used pronouns and different action words and adjectives. She was doing fabulously. Her intelligibility, or her ability to be understood, was also wonderful too. People who knew her and people who didn't know her were able to understand exactly what she was saying.
I would definitely recommend St. Luke's to anyone and everyone, and I speak their praises every day because they have made a tremendous difference in our lives, and I am extremely grateful and appreciative of everything that they've done.